Hi guys, it's Colleen again. I wanted to discuss today EDS and pregnancy because EDS poses it increases the risks of just about everything when you're pregnant. There's a lot of things to think about. And a lot of things that could happen or do happen, and I just wanted to go over that. It came to mind yesterday when I was seeing my osteopathic manipulative medicine doctor, and we were discussing how bad my pelvis is I don't know, situated, because my hips have a large discrepancy between the two, anywhere from 3 to 6 inches depending on the day and how often I've seen my osteopathic manipulative medicine doctor. And then my sacrum, which actually, oddly enough, not only slides down, like moves down out of place, and it leans the wrong direction, but then it flips. His word was, it's extreme. Nice, right? Extreme how out of place. And he's like, I've heard of other people's sacrums flipping, but I've been doing this a long time, and I've really never seen it a lot. So I wanted to go through some of this stuff, because this stuff happened to me when I was pregnant with both my kids. And caused major pain issues. And there's some things you can do that will help. I did not learn them until my second pregnancy. First pregnancy was a nightmare. So, first off, with EDS, our connective tissue is already loose and pliable and hypermobile, and it doesn't work well. And that connective tissue, it's everything, pretty much everything in your body. It's, muscles, tendons, ligaments, vasculature, organs, anything that holds you together or holds your blood supply in. Your brain is obviously connective tissue. Your skin is connective tissue, all of it. So obviously this is going to affect pregnancy, especially once the hormone relaxin kicks in, which is a natural hormone that works as a muscle relaxer to allow your pelvis and your abdomen to stretch to make room for that baby. So your pelvic girdle will widen and stretch out and loosen, which includes your hips, your pelvic pelvic bones, your sacrum, all of it. Okay, pretty much anything between your waist and your bottom, like thighs, I guess, is what I'm trying to say. So anyways, you mix already hypermobile muscles, ligaments, tendons in with a natural muscle relaxer, a really strong natural muscle relaxer, and you kind of get a nightmare, because then that baby's weight in there starts pushing against things too, and things get really out of place. And I know with my first pregnancy, sorry, like I said, I've always got to drink because of my meds. it was a complete and total nightmare. I didn't know what was going on because, number one, I didn't know I had EDS. At that point, what I knew was I had endometriosis, and I was never supposed to be able to get pregnant, but I did. And I wouldn't change that for the world because I have the greatest 20-year-old son. Anyways, so pretty much as soon as you get pregnant, that hormone starts building up in your system. And immediately, my entire pelvic girdle started just moving out of place. Not to mention, I started passing out immediately. That would be because I've got autonomic nervous system dysfunction, and pregnancy causes your blood supply to change. Not your blood volume, but it changes where you start, where your body moves that blood supply to first. So that blood supply starts moving to the baby, takes some of that volume from you to that baby, and you can start having lower blood pressures. And mine's already really low to begin with, and I've got a history of passing out, but my passing out went from 0 to 60 in about one day. No, I just started passing out a lot more often. So that's what I knew something was amiss. Anyways, and then, like I was saying, my entire pelvic girdle just kind of like went, wah. And I started having massive hip, pelvis, sacral pain, and bilateral sciatic nerve pain, to the point where I ended up on FMLA for 6 weeks in the first trimester of my pregnancy because I could not walk. I could not move without massive pain. I'd wake up in the middle of the night screaming. No matter, and they tell you when you're pregnant, sleep with a pillow between your knees, and yada yada, don't sleep on your belly, everything, and I'm following all of the recommendations. I immediately start physical therapy. And honestly, the physical therapist kind of nailed it without knowing it. She was the first one who ever brought up a connective tissue disease. She's like, all of your joints are so hypermobile. They stretch so far. I think you have a connective tissue disease. Have you ever been worked up for that? And I said, no. She says, well, it would completely explain why your sacrum is sitting in your hip socket. And I'm like, okay, well then, where do I go to get the diagnosis, and what do I do to make it better? She goes, I don't know. We don't see it enough to know who to refer you to. And I'm like, so then I talked to my regular doctor. She's like, no idea. I've never taken care of anybody with a connective tissue disease. And I'm like, great. Mind you guys, this is almost 21 years ago, because it was at the beginning of my pregnancy. And he will be 20 next month at the beginning of February. So, I do all my PT. I'm wearing a special back brace that's supposed to be locking my sacrum in place, and it's not working. Pregnancy belt, I wear the fucker to sleep. Nothing. I mean, and at this point, I'm pregnant. So the only thing they're letting me take is a couple Tylenol a day. Because back then, you did not take pain medicine while you were pregnant. And I'm one of those people who's very, religious about doing my physical therapy, because I know you have to do your home routine or the physical therapy is not going to do anything for you, so why even bother showing up? You know what I mean? And, and they're trying to manipulate, my pelvic girdle back into place, manually from the outside, and nothing is working, and I've got this huge leg length discrepancy because my hips are so far out of place, and literally, I was hunched over the entire pregnancy, and I was in physical therapy 3 days a week the entire pregnancy, and nobody really knew what was going on other than my structurally, everything was amiss. There was nothing in place. Like, ridiculously out of place. And so I go into labor. And mind you, once I got back to work, I worked until literally 12 hours before I gave birth to my son. Well, 12 hours before I was admitted in labor, I should say. Because, for some reason I stopped progressing at 4 centimeters, even though I was contracting like crazy. So anyways, I worked the day before I have him. Been in pain miserably for 9 months. At this point, I'm like, please, God, let me have this baby and hopefully the pain will go away, I do not progress past 4 centimeters. I end up on, Pitocin, sorry. And Pitocin is something they use to induce labor, to speed it up, because after 12 hours of being at 4 centimeters, they decided, my water had broken at home. And so that was already done. So they put in an epidural and started the Pitocin, because let me tell you, you do not want to have Pitocin without an epidural. The Pitocin just makes you contract that much harder. And within an hour and 3 pushes, I delivered him. And he was an 8.5-pound baby. But I had complications. So my sacrum slipped down into my hip socket, and when you're delivering a baby, your sacrum's supposed to be able to move out of place. The musculature and the bone is there so that it just kind of pushes back, and the baby slides through, and then it comes back. Sorry, you can't even see my hands, but anyways, that couldn't happen because it was locked in my hip socket. That hurt like hell. And that means that 8.5-pound baby broke my sacrum because it could not move, and it was locked in place. So no, after the pregnancy, the pain did not go away right away. Then I hemorrhaged enough that, the doctor, who is amazing, was yelling at the nurse for taking the baby away because I needed to breastfeed right away, because breastfeeding causes your uterus to contract, and by contracting your uterus, it helps to stop the blood flow, the hemorrhage. And then they were internally massaging the fundus, which is the top of the uterus, trying to make it clamp down and stop bleeding. These are things they do routinely when you're hemorrhaging. And then I got a couple methogen shots and 2 more liters of Pitocin. And I finally stopped hemorrhaging. But of course, we've already talked about the fact that I've got naturally low blood pressure. So I'm laying there basically breastfeeding my baby with my head below my feet because they've got me in a reverse Trendelenburg position while they're bolusing me fluids to replace some of the volume that I lost after I finally stopped bleeding. And when I was finally allowed up, the nurse left me in the bathroom to go get something, and I passed out. It happens. We nurses, sometimes we gotta run and grab something, and, you know, I'm an independent person, and I should have rang and waited for her to be there when I stood up to wash my hands, and that would be my fault. I did not, because I thought I was fine. Yeah, that's me. I do that. I'm sorry. I'm a great nurse, but a bad patient. Top it off. After the baby, I never actually stopped bleeding for over a year. At one point, I was getting Depo-Provera shots every 2 weeks. And they couldn't stop the bleeding. And that's because I've got vascular type EDS. And I bleed. And I bruise. And my skin is crappy. So, I mean, I get a cut. I get cuts easily, and then I just bleed like crazy, and it's just my natural thing. It's what I do. I'm used to it. I know what to do. Even long before I knew I had the EDS. I knew there was something wrong because nobody else bleeds the way I do, you know? So then with my second pregnancy, I had started working at a pediatric hospital. With my first one, I was working at a long-term care facility. But I had a friend who was also pregnant. And she was in her 3rd trimester while I was in my 1st. And her baby was breech. And the reason I'm telling you this is because she somehow knew that there's chiropractors out there that specialize in treating pregnant women. And there's chiropractors out there that specialize in doing a specific maneuver to help a breech baby flip. I didn't know that. So, knowing what I went through with my first pregnancy, I called my doctor and I said, hey, with all the pain and stuff I went through with my first pregnancy, would it be okay if I were to see if a chiropractor could help me? And he said, yes, but be careful on who you choose. You need to find one that works with pregnant women. There's a special certification, and you have to find one that has that certification to work with pregnant women for safety purposes. And they have a special table and all kinds of stuff. And I was like, great. Hopefully this will help better than physical therapy did. Because I was already having the pain. And sciatic, if you've ever had sciatic nerve pain for any reason, an injury in your back, an injury in your hip, a fall to the tailbone, any of those reasons, sciatic nerve is the biggest nerve in your body, other than the vagus nerve, and you've got two of them, one on each side, and that pain is intense. It is intense. It's not something to joke about. And it's not easily treated, and it's not easily figured out what's causing it. But as I was already having the pain, I knew it was going to come back, and it was going to get worse. The bigger the baby got, the more relaxing in my system, and I was not willing to do physical therapy for 9 months and not have any results again. So I was like, okay, we're going to try the chiropractor. This chiropractor was able to manipulate my entire pelvic girdle into place properly. Instead of it being tilted and twisted, she was able to manipulate it into the right way, the proper positioning, and keep my sacrum locked in place where it was supposed to be. Yes, I went to see her 3 times a week. Yes, I had $20 copays every time. I didn't care. $60 a week for not having the pain is so much better than $60 a week for 3 times a week for PT and having the pain the entire 9 months. So, with my second one, I did the chiropractor 3 days a week, the entire pregnancy until I went into preterm labor, which was 7.5 weeks early. And then I was on bed rest for like 3 weeks, so I couldn't see her. But once I was released from bed rest, they let me go back to see her because I was far enough into my pregnancy that it was okay if I went into labor. Yes, I ended up on terbutaline for that 3.5 weeks. You know, if I was 6 weeks premature, they would have let me have the baby. But no, me, a week and a half before they would let me, and I end up on terbutaline, which messes with your mood, it messes with your heart rate, it makes you dizzy. It's just, my mom called it my bitch medicine, because she's taking care of my 2-year-old while I'm laying there on her couch doing jack crap, you know. And then I saw the chiropractor like a day or two before I went into labor with my son, with my second, and I will tell you, it was so much smoother. I still hemorrhaged, but I didn't end up with a broken tailbone. I didn't end up with the residual pain because I had the broken tailbone. He came out easier, and it was just better. It was just better. But I still needed the Pitocin because I did not progress past 2 centimeters at a time. I'm in labor for like 48 hours and not 2 centimeters. Yay. My water's broke and everything, and I'm just, not progressing. That is me. So I ended up with Pitocin. Again, an internal monitor, an epidural. Poor baby came out with a bruise straight down his forehead from the internal monitor. It was horrible, but it's okay because he was still cute. Again, I hemorrhaged. Again, postpartum, I did not stop bleeding. Again, I ended up getting, Depo-Provera shots way more frequently than you're supposed to help stop the bleeding. But again, I ended up passing out. Again, the postpartum was pretty similar to my oldest, other than the pain. So, my recommendation, if you have EDS and you're pregnant and you're having hip and sciatic nerve pain or lower back pain, see a specialized chiropractor. But get clearance from your doctor first. I was fortunate that my doctor said it was okay. I was fortunate that there was a woman local that could do it. And the reason I'm doing this video today is because yesterday, when I was talking to my osteopathic manipulative medicine doctor, we talked about my pregnancies and my first pregnancy. And he's like, well, somebody should have been manipulating your pelvis and your sacrum the entire pregnancy. I was like, you know, I did PT, we did everything we could with that, but I didn't know I had EDS. And believe me, if I knew that I had a chiropractor, or that a chiropractor could help better than the PT, I would have done it. So, now, I'm going to talk about my feelings about EDS and having kids, considering it's autosomal dominant. Me, as a mother and a nurse and somebody who's a natural caregiver and always has been, I feel fortunate in a way that I didn't have to make the decision, because I didn't know I had EDS. So I didn't have to make the decision as to whether or not I'm willing to pass something that's autosomal dominant and something that can either mildly affect you or severely affect you onto my kids. And knowing what I've been through, especially in the last 10 years, I don't know if, having known, I would have made a different decision. I cannot say that if I knew before I had kids that I would have had kids. I can say in some way I would have had kids. If it was adoption, if it was using somebody else's eggs, you know, I would have found a way to have kids, but I don't know that I would have had my own kids. That being said, I would not trade my children for the world. That being said, likely, it's a really good chance that I have passed this on, and that upsets me because I have severe mom guilt. But would I change it now? No. If I knew earlier, maybe. But every individual needs to make the right decision for them. And I'm fortunate that I did not know. I can tell you that, having watched what I go through, both my kids, who are mature, very smart, thank God. I mean, these kids are smarter than smart. I'm fortunate. I'm very fortunate. And they're mature for 17 and 20. Usually. But both of them, after watching what I've gone through and knowing that they could pass it on, have made the decision that when they find the people they're going to spend their lives with, they are not going to have their own children. Will they have kids in some way? Or I should say, by some way? Yes. They want children. They just don't want to pass on EDS. And there's ways to have kids that you don't have to pass it on. You know, there's adoption. There's using other people's, if you're dying, other people's sperm. There's you know, all kinds of ways. And so this is a bad enough disease that it is something that, and that makes people think, should I or should I not have my own children? And that's sad. And because it's autosomal dominant, there's always a good chance that you could pass it on. And you can have genetic testing. You can talk to a genetics counselor. You can see specialists and talk to them about having kids and the chances. And the problem with EDS is, even if, as a parent, your EDS is mild, that does not mean that if you pass it on, your child's EDS will be that mild. So, because it is a spectrum disease and it's so very different in every person, it takes a lot of consideration. And it's something that my kids have thought about. I'm thankful I didn't have to think about it, because I didn't know. I didn't know I had this until 3 years ago. And I'm 44. But if you're out there and you have EDS and you're thinking about having kids, you know, just remember there's other ways to have kids. Just remember you never know what's going to happen. And make what decision is right for you. And don't let anybody else make that decision for you. Alright guys, if you made it through to the end of this video, I appreciate it. And thank you. Have a good day.